obesity paradox is a term that's like very controversial because we know that obesity is a risk factor for many types of diseases. But the paradox comes from when we treat those patients, they respond very well as compared to the patients with normal weight or normal BMI. And that was a very well established fact in cardiovascular diseases, and more recently it has been established in melanoma and lung cancer as well. But I would say there were not many studies, or the studies in GI cancers were limited by the sample size. So we had access to a national database that's called Trinitex, that's a de-identified, aggregated, and one of the largest database in which you can simulate clinical trial design, you can propensity match, and you can ask your questions. So basically what we tried to find out was, like, does this obesity paradox, people who are obese have better outcomes when they receive immuno or chemotherapy in GI cancers? Does this effect exist there as well? So we tried to look there, and we found out that it is in fact existing in GI cancers as well. We found that people who had a higher BMI had like almost double the overall survival. It was 27 months approximately, and approximately 14 months in normal BMI after starting immunotherapy, which is like a stark difference. And this finding is kind of like a little bit complicated because we know obesity is a risk factor, and now we are seeing good outcomes. So this does not mean that patients have to gain weight to get better outcomes, or they have to eat more. It's just an observational finding. We still have to test the hypothesis, and that's basically what I have to summarize my results.